Now, welcome to the last lecture on applications of Chatgpt in healthcare. Again, the purpose of this lecture is to make our healthcare professionals realize that although their job and their work is almost AI and machine learning proof currently, but this field is developing and exploding so fast that this skill is worth developing in free time. Let us see. And doctors, etc., are always intellectual people, so they would usually not believe, which is a good habit, without some adequate research backed evidence. So let us start with a research paper of 2019. I am telling the brief summary of it, that doctor jobs are safe, but I am adding for now. And that, remember, that was with respect to this research paper of 2019. We are in 2023. Also, this particular lecture is presented in a slightly highly academical manner, in which each and everything will be presented with a link to the corresponding resources. Okay, this paper was presented in Royal College of Physicians, and it is in the Future Healthcare Journal. If I see that paper, in the last slide, I have given all the notes. I mean, sorry, all the links. So if we open that, yes, this is that paper, Royal College of Physicians, Future of Healthcare, and all these links are already there, so you don't need to write. These are the authors, okay, Thomas Davenport and Ravi Kalakota. And I am not going to present the whole paper and everything because that would be very boring. But those who are interested should see this because it has excellent summary and also very nice bibliography here, where it give references to other person's work. Okay, we don't want to go into detail of it in this lecture, so I have just written summary for you, that what are the key takeaways. Now the key takeaways from this lecture: one, the complexity and rise of data in healthcare, and there is link 21. If you follow that link, then you will realize that I'm not opening, instead you I'm leaving that to you because it will break the continuity. But currently healthcare analytics is the big growth driver all over world, and it has surpassed manufacturing. And healthcare data accounts for around 30% of the total data which is generated globally in 2023. Okay. So there is big rise in the amount of data related to healthcare, and there is complexity also. Healthcare is always a complex domain, and even the expert of AI and machine learning They find it the most difficult to develop a solution for this domain, and they have said that we can at the most reach at present up to the level of a medical assistant, but a doctor himself is irreplaceable currently, and it will remain so for around 10 years at least. There are three spheres in healthcare where AI is already being applied. One, diagnosis and treatment recommendations. Second, patient engagement and adherence. And third, administrative activities. Now, the level of success in each of this is different. For example, in diagnosis and treatment recommendations, it is still the doctors who call the shots, both their skill wise as well as regulatory permission wise. So AI tools or machine learning tools are not permitted even in country like US to diagnose or treat patients on their own without supervision of an expert doctor. Okay, but they have done, at the same time, AI based tool have done a lot of progress in this field, patient engagement and adherence. Uh, because actually speaking, even in developed countries where there is no scarcity of qualified doctors like we have, uh, there is a situation where you ask for the appointment and you get the appointment after sometimes many days, because many of the doctors, their lot of time, or even medical assistants, their lot of time is used up in this. So if these two processes, patient engagement and adherence, and administrative activities associated with healthcare, for example, maintaining patients' healthcare records in digital format, and in many countries there is a certain standard which one has to follow, and there are certain privacy rules which one has to follow. So maintaining all these things is a difficult task, but currently they are done mostly manually. But now around 30 to 40% of the task in developed country among these 2 and 3, that is the work of administrative assistants or medical assistants, that is being slowly transferred to machine learning algorithms and artificial intelligence. Okay, there are some hindrances also. For example, one, and this hindrance is the biggest hindrance in, for example, in our country, that we do not have electronic health records. You can analyze data and then develop a tool based on that data, provided you have first the data in digital format. So most of dollars. IBM Watson is primarily made for cancer research, but earlier this link will show you that earlier scientists or healthcare experts had a lot of hope from it. But then they slowly realized that IBM wants to focus. Again, I'm talking about the situation as per 2019, and now it has changed. But it, at least in 2019, this research will tell you that IBM focused on few specific types of cancers and not all. So, in short, there are no general purpose tools. So it is difficult to incorporate one tool which can do everything in overall healthcare ecosystem, which is always complex system. And then there are ethical issues. Ethical issue include privacy of patient, what is the right of determination by the patient that from whom he gets a treatment, and all that thing. So conclusion of that paper, this paper can be, it will take even a decade, that is up to around to 2029, before wide scale application of AI in healthcare in developed countries. And in India, I think it will take perhaps maybe 20 years. But those young doctors who are learning or who are uh, just currently entering the practice, they should start learning about this thing. And there is absolutely no hurry. That is the biggest advantage which the doctors have. They have plenty of time. Slowly, slowly, they can master that skill. And I mean, they don't need to master everything. They just need to master few tools which are very simple to use. Okay. Now, where AI and ML are already doing great job in healthcare. For example, this is one thing. They are already outperforming radiologists at spotting malignant tumors. However, there is one but to that, and the but is that radiologist's job is uh, not just to find the tumor or lesion in the X-ray image or MRI image. Thereafter, his job is multifaceted, counseling the patients, then collaborating with the surgeon or maybe chemotherapist or other therapist who is going to treat that tumor. And all that work cannot be done by machine learning tools. Why AI tools are better at because of their AI often is combined with augmented reality. So our human eyes have a lot of limitations, but you can see magnified and three-dimensional images. Then obviously it would make it easier to find even the smallest beginning of lesion or tumor. Then there are algorithms who can guide a researcher in constructing cohorts for costly clinical trials. Clinical trials also have three problems. One, cost. Actually, one new drug development is around a 10-year cycle or around even 15-year cycle, including the granting of patent and receiving the permission from the authorities. Okay. Second, ethical issues that trials are done often on animals or then even after animal trial, even human trials are done. And for that, how to create cohort and how to shortlist the candidates, their machine learning algorithms can help. Then precision medicine, here again, AI is doing fabulous job. Precision medicine means predicting what treatment protocols are likely to succeed on a patient based on patient's attributes and treatment context. So basically, that means a personalized protocol for that patient. And the value of personalized care is increasing in service sector, and healthcare sector is no exception to that. Okay. Neural networks are, which is one another type of machine learning category, category, but they are useful for categorization of applications, like determining whether a patient will acquire a particular disease. So they give probability based on your parents' history, your past treatment history, based on your symptom, that how likely you are to acquire a particular disease. And that famous example of Angelina Jolie is well known that she, according to her genetic history, was advised that she has very, very high probability of developing breast cancer, and she underwent surgery for breast cancer even before she developed breast cancer. Of course, how advisable that much precaution is. that is one's individual choice, but this is the most well-known example where in advance one can predict. Okay, deep learning is used in potentially cancerous lesions in radiology images. Here, actually, thousands or millions of images database is fed into the algorithm, and the algorithm finds the image. Or rather, the algorithm learns from those millions of images, and then patient's MRI or X-rays fed to it, and then algorithm finds that if there is a beginning of cancerous lesion. Okay, it is used in radiomics, that is detection of clinically relevant feature in the imaging data. Again, imaging data. So radiology and imaging, they are greatly benefiting from this. As I said, still radiologists cannot be replaced, but these tools can work as a great assistant to them. Okay. The beyond what is perceived by human eye, this I already discussed, that augmented reality and much larger and three-dimensional images can be created, so it is easier to detect things. Then NLP systems are used for clinical documentation. This is one part which is often neglected, but because practicing doctors hardly have time to document each and everything, but such documentation is very important for a research purpose. So if adequate data and documentation is there, then research can be easy. And natural language processing NLP system, which is our ChatGPT, actually based on, so that such a systems are used for creation of clinical documentation. Okay, we continue with some other applications. NLP systems are also used for analysis of unstructured clinical notes. Because we saw in previous lectures that doctors have that particular jargon due to the lack of time, and every just like every other profession, they use certain acronyms, they use certain uh, short forms, then certain technique of writing, almost like a shorthand developed exclusively for healthcare sector. And such unstructured clinical notes must be converted into structured and proper data so that they are ready for analysis. So that can be done by NLP system. Rule-based system are employed for clinical decision support, and many countries are already using rule-based system, and there are several practically used applications recognized by who or other equally reputed bodies. Surgical robots were approved by US FDA in 2000, but with, of course, supervision of uh, qualified surgeon. They assist surgeon in gynecologic surgery, prostate, and head and neck surgery. Then there is RPA, robotic process automation, which takes mundane daily administrative tasks of running a hospital, like prior authorization, updating patient records. Then this technology can make the overall functioning of the healthcare setup much frictionless, so that doctors can focus on their real job, that is treating and caring for patients. Now, some successful and not so successful AI based tools. Remember, we are still talking with respect to around that 2019 time frame. So later on, we will take some tools which are already successful and already very widely being used in many countries. But for example, Stanford developed this tool called mycin for diagnosing blood-borne bacteria, but it was not so successful uh, because of diagnostic weakness. But remember, that was 1970 or 80, so that was quite old. Okay. IBM Watson, this is a continuously developing product. Still, they are increasing further and further investment and further improvements in that. Was used for cancer diagnosis. It was not so successful in 2019, but that is what you will learn from this link. But today they are s- claiming, and many doctors have certified also, that they are better than oncologists for diagnosis of treatment, but not for diagnosis of cancer, but not for treatment, of course. Then Google and health delivery networks, they are building prediction models for from big data to warn clinicians of high risk conditions such as sepsis and heart failure. So again, data of millions of past patients from past hospital records is fed into this algorithm. The data is anonymized, privacy and all that things are taken care, and then based on that data, a particular newly admitted patient, these algorithms can help a doctor predict in advance that this patient may develop sepsis or this patient may develop heart failure. So in his ICU, it is better to put a trained person in that corresponding skill. Okay. There is this tool JVION, uh, which offers clinical success machine. It identifies patients who are at most risk and what most likely to success. This Google's prediction models are partially successful, and this also is partially successful. So it is a clinical kind of clinical decision making assistant for the doctors. But remember, none of the tools, neither the rule, nor ethics, nor the development in AI is that skill should be used. None of the tools should be used without supervision of qualified doctor. But this was the situation in around 2019, maybe 20. However, I have written that there is some things where healthcare research is doing, I mean, these tools are doing fabulous job. For example, this is just maybe 1 week old news that there was a critical threat bacteria. This critical threat categorization was done by whom? That is this bacteria, and it is so common in operation theaters and all that all over world, uh, doctors are literally fed up, and it has long life on surfaces, on gloves, on equipment, say a catheter which is shared from one patient to another, or maybe other surfaces in the room of the patient. So scientists were trying, and it is stubbornly resistant to all antibiotic. No antibiotic exists for this bacteria. That was till now. But just 1 week back, these researchers, McMaster University in collaboration with MIT, employed AI algorithm. They screened this many bacterial molecules. I told you that finding a new drug is a very difficult and time consuming process because of that 14 to why it takes so many years, because you have to try thousands of molecule one by one. Some may work, some does not work. So if you can somehow shortlist this is what these algorithms do, that instead of trying all these molecule one by one, they shortlisted 240 compound only, and for which lab testing was required. And after lab testing, only 9 potential antibiotic emerged. Now think about, if we have not used machine learning algorithm, and we had done lab testing of each and every of these thousands of molecules, how much time it would take. So they found one particular drug for this. Now in surgery, Currently, even in India, precision and minimally invasive surgery is becoming more and more prevalent, particularly in, say, two, three domains. One is cataract, one is the liposuction and bariatric surgery, one is knee surgery, and so on. Then intelligent surgical assistant, remote and telesurgery. These things will require some time. Augmented reality, that we have told, I told you that augmented reality will help us to overcome the limitations of human sense organs and help the surgeon to surgical simulation. How to train surgeons, that is also a big issue, because on one side you cannot take patients as guinea pigs, and on the other side, without actual training, the junior surgeon will not develop the confidence. So surgical simulations are developed, and most important thing about these algorithms is that they are continuously learning. So the more you use them, the more they become intelligent, just like our human brain. Okay. In mental health, at present, maximum amount of investment is going on in mental health related solutions using machine learning for intervention and early detection, for bots and virtual assistants, because many persons find it more comfortable to open up in presence of a remote doctor or maybe just a bot, provided of course that their privacy is maintained. These are the benefits. Real-time feedback is obtained, reduced human interaction, better diagnosis, and reduced stigma. With mental illnesses, skin problems, there is a lot of stigma attached. Okay, and sometimes even the offsprings, the children of the patient also have to suffer. So many people do not go to doctors clinic physically, or do not want to go to doctor's clinic physically, because of fear of that stigma on their family. So such people uh, can approach through tele conferencing, or they can use bots. However, there are problem areas also. Because if you want to train a nice bot who is as good as maybe a mental health care professional, today again I am telling no such bot or tool exists, and advice of a qualified doctor is must. There is no substitute for that. But to get to that level, we will require data of maybe thousands of patients of that particular mental illness. Now, the question is, who will be responsible for the security and privacy of data? Also, who will be responsible for security and privacy during those web conference? As such, a solution of this problem are already thought. For example, in US, there is this HIPAA standard. European Union has a even strict privacy standard. So all apps, etc., which are made for mental health or other healthcare, they must comply with this. Otherwise, they don't get permission to launch themselves on Google Play or other app platforms. Okay. So this things, and one better way of doing this is two better ways of doing this are, one is anonymizing data completely, so that there is all personally identifiable information from the data is removed, and second is using blockchain, so that immutable ledger is there, so you can or nobody can tamper with that data. Okay. However, still there can be other problem. For example, the bias in the data can be there. Also, patient's autonomy, that patient consent that you are being treated by a virtual assistant must be taken. Legally, it is required, and ethically also, because mental health issues are not just issues of knowledge. human touch, empathy, and many other things which only human beings can provide. They are required. So just we are in a stage of flux, but we are trying to bridge the gap, and doctors should be rest assured that nobody is trying to replace them, but trying to make their life easier and trying to remove the mundane jobs so that they can focus on the real job. Okay. This is one big domain, health insurance, because in health insurance, a lot of fraud occurs. Sometimes reverse also occurs. Person is genuinely files a claim and he was genuinely hospitalized and uh, incurred a bill, but insurance companies become suspicious and they reject the claim. So claim processing is a headache for all patients, doctors, as well as insurance company. Companies often say that we lose a lot of money because of frauds. Patients complain that companies are not providing the promised insurance protection. Doctors consider this as a peripheral headache because they also have to often do a lot of paperwork and sometimes even go to the court to give as a witness. So this is one area where machine learning algorithms can help a lot, and there will be a lot of cost saving, and that can help everybody to get a cheaper insurance access. This sector is also growing phenomenally because here there are less ethical issues, there are less legal issues, because no direct treatment is involved. So that's why this sector is also growing phenomenally. And now some real life examples. You can see each of these example. I have given link. So IBM Watson can now diagnose. That is the same IBM Watson which was kind of said semi-successful in that 2019 research. And I said that they keep on improving and investing money in that. Now it can diagnose cancer faster and more accurately than human doctors. So this is a study which is monitored by doctors. However, treatment part is still the doctor's prerogative. Google plus DeepMind generated an AI can deteriorate, predict patient deterioration 48 hours in advance. There is Pisces Predict, which is a cloud-based platform. Here, I would like to open this if it opens, or because I just want to show something that okay. But this platform, when you go to its page, I think in the video it is not opening. But when you on the last slide, I have given all links. So when you go to its page, you will see that big giants of healthcare and technology are involved with this particular. Then also see this 10 real world example. This Nuance Darks Express is another tool which is now Microsoft acquired. There is also Pisces Predict is, I think, Microsoft acquired perhaps. This Epic perhaps is also Microsoft acquired, not Pisces Predict. I'm sorry. Uh, then there is this tool called Sibyl, which can predict a cancer risk up to 6 year in advance with an accuracy of 86 to 94%. This is the link, and the whole article is written and vetted by an MD doctor. Okay. Then there is tool called Levita, Empower MD, Cloud MD. So please go through these links. And lastly, this Spark NLP. Many people often, particularly in critical sectors like healthcare, find it difficult to trust ChatGPT because it is a generalized tool. It is like jack of all. So they think that maybe it is master of none, though it has proven those people wrong many times. But still, so the Spark NLP is based on same technology as ChatGPT, but it trained on data which is exclusively for taken for healthcare domain, and it is a cloud. They provide cloud based solution. So even in India, if there are hospitals who have quite even moderate budget, cloud based services are not that difficult because uh, they are availed on pay as you go type. So you can, as a trial, subscribe to them for maybe 2 months or 3 months, and if it works for your whole healthcare setup, then continue, else discontinue, like that. Okay. And finally, this is what I have made from all reading all everything about healthcare, and I had to read a lot because this is a tough domain. But these are the stages of healthcare according to who, as well as many healthcare researchers. First is patient education and disease awareness, and second is this, third is this. And I have chosen shades of green for where AI and machine learning tools are doing good, and shades of red where they are doing poor. So you should understand, in patient education and disease awareness, obviously machine learning tools and algorithms are doing good, and there are not many ethical or regulatory issues. But symptom assessment and diagnosis, well, that is still doctors' complete expertise. Then this care planning, this is also they are doing good, but moderately good. So that's why this is not very green. Ongoing disease management and just monitoring, yes, they can do that. For example, I have, I don't know, yes, I have this smartwatch. A simple smartwatch costs me only maybe around 3,000 rupees. So I just wear it. It can give me my, everybody knows about these tools. ECG, blood pressure, it can give me SpO2, which was vital during COVID. It can give me heartbeats, pulse, everything. Now there is only one thing. Nowadays they are making even the clothes wearable, so that there will not even be need to wear a watch or any other device. Now there is only one thing required, that this should be able to transmit that data to your doctor's computer. Then your doctor may be having 100 patients, but every day morning when he comes to his office, on the computer monitor he can see that these and color coded things are there. So they easily he can see that 10 patients have color code, red color coded. So that means something terribly wrong happened with them during the night. Maybe their ECG deteriorated, or maybe they had severe BP problem, or asthma patient, then oxygen level went down, or maybe whatever. On the other hand, for the around 75 or odd people, it would be green color. So that means they are doing well. Okay. And blue color, maybe mild minor complaint. So the doctor can develop a system of follow up with those 10 red colored people, and priority can be given in appointment to them, and based on that, rush can be predicted, how much rush will be there in the clinic. And hospital beds often go often you don't find hospital bed, and often so many beds remain unoccupied. Both ways it is a problem for a healthcare setup. So that those things also can be predicted, how many beds are required and all. So this is my assessment after reading that in this administrative and monitoring and education, patient education task, I think this machine learning and AI will soon enter. However, this task, diagnosis, symptom assessment, early detection, and of course the treatment task, I don't think that in coming 10 years AI and ML tools will enter healthcare domain. However, technology has a habit of proving many great people wrong, so I hope I'm right. Thank you.